Hello, and welcome to the Beverly Hills Plastic Surgery Podcast. No, your eyes and ears are not fooling you. This is producer Sean G. Dr. Calvert is off being the global icon that he is. I think he is in Houston. But I am still sitting across from our now rising superstar, Dr. Millicent Rovelo. How are you doing?
I'm doing great. I'm so happy to see you sitting across the table from me. Usually you're like behind the booth giving us thumbs up or sometimes thumbs down.
Yes, I get to hide behind the camera where I like to be, but I've been pulled out I'm going to do my best here. But Dr. Rovelo, you're doing better than great because your new show has just launched. We did an episode about a month ago where we had made an announcement that you were joining a new TLC show called About Face, which is insane, first of all. So we're going to go through a little episode reaction, kind of go over the first episode. I wanted to maybe get a little behind the scenes stuff from you and ask you maybe some dumb audience questions. So wanted to pop in and kind of get your reaction and kind of maybe go through the first episode, maybe get some behind the scenes out of you. And so let's start right there. How has the reaction been? I mean, there's been 2 episodes. How has the reaction been in social media and the like?
Reaction has been really positive. I can't express how genuinely people are responding to this in a really positive way. And I think they just appreciate seeing, it's the stories, right? It's the stories of these patients that have struggled for whatever reason with various facial differences, and to be able to see them overcome it in some way. I mean, that is the power of plastic surgery. That is the power of what we do, usually to a smaller, more subtle extent in our daily plastic surgeries, but to the extent that we can do it for these patients, it's life-changing, and people have really responded positively to that, and I love that.
Well, so I just wanted to give you some immediate reactions as well, and then go through the episode itself. And you right off the top, Dr. Andre Panosian says kind of in the beginning, once you get in there, there's no manual. That was really striking to me, and that became clear as you got into doing both of the surgeries in this first episode. But this isn't just your regular old. I mean, every surgery is serious, as you guys have always said on every episode. But I mean, it was really apparent in the 2 cases here that this is a really different territory. So, first of all, just wanted to give you both your flowers for even being people that are willing to try this kind of thing. So.
Now, I thought what he said was really interesting, and I loved how he said it. Like, there is no manual for this, because we do go through our training and our residency, and we do crazy cases, and we have all this experience, and you collect all of these tools, and you have all of these cases that you've done, and you've done them in different ways. But they're not going to be like the next case that you're doing, especially not these complex cases. And sometimes you get in there and it's not what you expected. And you really have to think back and draw on all of those previous experiences, everything you've learned from other cases, and use that to kind of come up with a plan sometimes that's different than what you initially planned. There is no manual when you're in surgery. You have to just use all of your other tools that you have at your disposal and just your experience from doing other similar-ish cases.
And, credit to the patients themselves, too. I mean, they know full well that they're walking into these types of projects. And,
yes.
As you say, and as y'all have pointed out, a lot of them have already tried in the past, and
right.
it failed. And, that's why shows like this are really important and really great, because how many people go to the doctor one time, get their diagnosis, and say, well, that's it, or they go out for one try and they say, well, that's it. And so, I mean, that's what's great about these shows is maybe it's giving some people out there some hope to try again.
Right.
And, maybe let's go talk to somebody else and open it up a little bit. So
absolutely.
So we'll go through a little show synopsis real quick of like what happens, and then we'll get into the episode itself. And I wanted to ask you a couple of behind the scenes questions of how you guys are accomplishing this on camera. So first of all, the show is about an hour in commercials. So I think the runtime somewhere around 37, 38 minutes. I think it's shot really well. I think it's really intimate. Like you guys say, the focus really is on the patients and on the patient's stories, and y'all are there to help solve the problems and then do the surgery. So I really liked that it was really patient-focused,
right.
and really enjoyed the pacing of it as well. I thought it moved along really well. So just some comments there. But as far as behind the scenes, so looks like I said, you're doing about 2 cases per episode that you're rolling out, and it looks like all 3 of you are collaborating on every case. So is that really what's going on? Are you all 3 collaborating? Because we saw Dr. Panosian in the surgery room with the first patient, and then I think Dr. Rostine and yourself in with the second patient. So to what degree are y'all collaborating?
Right. I think they really tried. I think this was maybe the only episode where there was a surgery where Dr. Panosian was by himself. I think for every other surgery that we do, one or the other person is with us. There's usually 2 surgeons doing the case. So we collab mostly for the surgical aspect of it. But for the most part, we're kind of working the patients up. And then you kind of saw a little bit in the episode that we present them to each other and get feedback from each other on what someone else might do or what they think of the plan. And then there's usually 2 of us doing each individual surgery with one lead surgeon, obviously.
Okay. And like I alluded to before, credit to the patients for not only pursuing to do this, but pursuing to do this on camera.
On camera.
I mean, it's just a whole nother element that you can't overplay. I mean, so as far as the process with the patients, are they just doing this on camera for the first time, or are y'all doing maybe a consultation process and then doing it again for camera's sake? Because I feel like
you want to know the secrets of the show.
I want to know the secrets. Give us the secret sauce, Dr. Rovelo.
Well, obviously we know the patients because we have to approve of them being on the show, because we have to make sure that they're actually appropriate candidates, that they will benefit from having a surgical procedure. So it's not entirely blind when we go in and see them for the consult. We've already reviewed a lot of their history ahead of time just to make sure that they are appropriate candidates.
Right. Okay. All right, well, let's get into the episode. It starts off with patient Rick is the first patient, and he unfortunately has a humongous tumor on his left cheek, and my goodness, it's the size of a baseball.
It is a very large tumor. I mean, that you really can't look away. It's like all you see.
Yeah. So, I mean, incredible story, and I think he said 2016 is when it started, and so it looks like, man, there was a lot of time in between, so... Again, why these shows are so great is to get people to go to the doctor, I mean, goodness, what took him so long to get there?
Yeah, I think there was a lot of nerves and anxiety related to having a surgery. When he initially saw some of the doctors that did his diagnoses, they told him that he was going to need a big surgery and that there was the potential of compromising facial nerves or normal structures in the face. And I think it really freaked him out. And he thought, maybe I can get away without having surgery. Maybe I don't really need it. But then obviously it just kept growing and progressing to the point where it was really causing not just, physical concerns, but also it was causing some strain, I think, in his family life as well, to the point where he was like, enough is enough. And let's just, put aside whatever fears and anxieties we have going on and get this addressed.
Also, random comment here. His son is like 7 feet tall, is he not? Levi? Shout out to Levi. You're a great son. But yeah, he is like 7 feet tall. His story is just great, and I'm sure it's reflective of everybody in this season, and a lot of things that he said, like, some woman was scared of him, and, and then he said, I'm a monster, and... Yeah. It's just heartbreaking what these folks are going through and what cards they're dealt. But that's why you superstars are here to come and solve some issues. So let's go into the surgery a little bit of Rick.
Yes.
Like I said in the beginning, or like Dr. Panosian says in the beginning, there's no manual, and that was apparent as soon as he got in there. It was pretty easy breezy once he got it open, and then the intricacies of deciding what to cut and what not to cut. I mean, talk about the difficulty of surgeries like that.
Yeah, that was a really tough surgery. And it was just because that tumor was so wrapped around all of what is considered normal structures, the facial nerves and muscles, like these structures that are really A, tiny, and B, super important to making sure that your face works. And so the meticulousness that you have to dissect this giant tumor that's just entwined around facial nerves, it's a lot. Like that surgery ended up going a little bit longer than I think even Dr. Panosian planned it to, because as he said, you don't always know what you're going to find when you get in there, and you just got to go with it. Like, you can't just stop and bail. I mean, you can, but that's not why we're there. And as long as the case is moving and you're making progress and things are going well and the patient's doing well, you just stick with it until it's done.
Well, let's talk about the transformation because, wow, I mean, and as you guys all see, it looks one way when you're done and then you let them heal a little bit. And wow, he's got a huge, cut right in the middle of his face, huge scar right in the middle of his face. And as you guys say all the time, scars are something that you can take care of and they do go away, you know.
A scar is much easier to cover up and ignore than a giant tumor in that area.
But wow, he really looked great. And not only did he look great, you could tell in just his overall life quality has really improved. Like you could see it in his face. His happiness has returned.
Yeah, he was really just radiating joy, and it was so great to see.
He really, really was. So let's get into your patient now, which was patient Danielle. Tell us about working with Danielle.
Danielle, first and foremost, is probably one of the most lovely people that is out there. Her energy and spirit is infectious, and she is bubbly, and she is she is a just genuinely amazing person. And she's had to go through her whole life having a very visible vascular malformation smack dab on her face. And she's heard it all. I mean, you saw in the episode that for the most part, she's a tough cookie. But when she really thinks about a few things in her life that have upset her, it still gets to her, But I think for the most part, she has gone through her whole life with just incredible grace related to every aspect of this condition.
Well, couldn't agree more. Saw that she had a terrific personality, and you could tell that she's doing what she can to not let it affect her. But again, we're all human beings.
We're all humans, and people can be really mean.
Right. Yeah. So again, credit to Danielle for coming in and trying again. Because she was one that had tried before.
She had tried
she
a
saw
few
some
times
promise with laser in the skin part, but her lips were another issue, and so. Talk to us about, I thought you had a hilarious analogy there when you got into doing her lips. You said this is like a layer cake just smashed all together, and then you have to piece through which layer is which and try to decide what to keep and what to... I thought that was an amazing analogy, but talk to us about getting in there and working on her lips.
Yeah, that's what it was. The lips have layers, and in a quote-unquote normal lip that doesn't have any trauma or any pathology, the layers are very obvious. It's like, oh, you have the skin, you have the mucosa, the wet part of the lip, then you have the muscle that sits right below that, and you can see it as you cut through it. You know exactly what layer you're in, and you can stay safe because it's very, where all the nerves run. They run through this layer of the lip. But when you have this tumor that's really grown all throughout the different layers of the lip and displaced the normal anatomy, when you've had multiple surgeries that's created scar tissue that's also displaced the normal anatomy, all of a sudden you don't have those landmarks anymore to guide you where you are. And you want to be really careful because, again, there's nerves and there's muscles and there's important structures that you don't want to cut through. And so that layer cake analogy is like once you've smashed that layer cake and you have no idea what your layers are, but then you find that one jelly layer that is in the center, and you're like, yes, I know where I am now. That's kind of how it felt like when we found the muscle layer, when it started twitching and jumping for us. It's like, okay, now I know where I am.
You got really excited. When you hit pay dirt there. And that was the other compliment that I wanted to give you was your enthusiasm in the consultation, in the surgery room, like your passion for your trade is truly apparent. I mean, from your care for each and every patient that you see down to just little victories in the surgery room. I mean, not all by yourself, but you and your team,
right.
So I applaud you for your enthusiasm, and also your enthusiasm and your confidence is also what gives confidence to these patients to take that journey with you. So credit to you for being a great doctor. This is also why we do this podcast, is to give folks a look at who is working on them and who the people are behind the masks and behind the blades. And, so credit to you for really, keeping their spirits alive is like such a big part of it. We talk about it on every episode about the aftermath of every kind of surgery, elective or otherwise. And, there's some immediate, what did I do sometimes? So, you guys are real superheroes in not just the surgery aspect, but the managing of the entire process. And, the person that you are is really carrying a lot of weight there. So I wanted to commend you on that.
Well, thank you.
So her transformation, Danielle's transformation, wow. I mean, night and day. It's just gone.
Yeah.
So incredible work. So in what we saw with the lasers, I mean, it looks like it's completely gone. Is she still going to have more sessions of lasers to go through? Is she basically done at this point, or is there more to her case?
She's definitely going to need more lasers. This will never go away completely. She's still going to have some pink/purple discoloration to some degree in those areas. It's never going to look entirely like normal non-pigmented skin. And it can kind of continue to come back in a certain way. So a lot of times the laser treatment is almost more maintenance. Like you get it as good as you can possibly get it. And then you kind of have to come back every couple of years to just get what's recurred or come back or regrown.
Well, the transformation part of the show is obviously the big payoff because, you not only see how incredible y'all are, but the reaction from these patients. And it really is life-changing. And we see it all the time with just basic elective surgery, people needing breast reductions or rhinoplasties and how that can change their life. But when you have something so traumatic either happen to you or something that you've been carrying with your whole life, I mean, that weight cannot be overstated, you know, and that weight being lifted is just so apparent in each one of them. So, wow, blown away. Really, really proud of you. Let me just give you all the flowers for you, Dr. Panosian and Dr. Rastine. Y'all are doing incredible work. I know that every patient that you have worked with and all of the doctors and colleagues that you've worked with are very, very proud of you, as am I. So a wonderful job. Can't wait for more.
And there's more. Stay tuned.
And that's
there's
right.
More.
That's right. There are 2 episodes out so far. How many episodes are in the entire season?
So there's 6 episodes total. We've put out 2 so far. We just went through the first one. The second one we'll probably go through later at some point. But if you don't want to get the spoiler alerts when we do these podcasts, you have to keep up with the episodes and watch them so you don't get the results ruined for you when we recap it.
So stay tuned.
Stay tuned and watch.
About Face on TLC every Wednesday. Mm-hmm. Starring our very own Dr. Millicent Rovelo. So, Dr. Rovelo, I think this is it. Are there any other last comments you'd like to say, or any last messages to Danielle or to patient Rick?
Well, obviously just the big thank yous for coming on the show and being so amazing. And what I love what they did with the show, and you'll see it in each episode, is when they do their kind of transformation shots, they have them, all of them smile. They have them give their smiles, and their smiles, every single one, and just pay attention to them. Those like after smiles, they're so heartwarming to see. And they're so I wouldn't say that they're changed people, but you can just sense that, just relief and happiness and confidence that they now have.
100%. I had one last sort of question for you, and it's about how, crazy some of these projects are to even take on. You guys do aesthetic surgery and you do reconstruction surgery, and often it's sort of one and the same. Would you say that the aesthetic world is informing the reconstruction world more, or are shows like this reconstruction world, showing what's possible in the aesthetic world?
Oh, that is a very astute question. Because historically, we've thought of them as being 2 separate tracks in plastic surgery. You're either a reconstructive surgeon or you're an aesthetic surgeon. And I think that in both tracks, we have much more blending of the specialties than we used to before. So when I'm doing my reconstruction cases, I'm bringing all of my aesthetic experience into thinking, well, not just how can I make this back to normal, but actually how can I make it maybe better than what normal might have been, and bringing all those aesthetic principles into it. And for the same way, when we're doing technically aesthetic-only cases, you're always thinking about, well, what is the function of this part of the body that I'm working on? How can I make sure that I don't affect that as well? Right. So I really think that you have to have both, either one you're doing.
Right, right. Well, y'all truly are superheroes, from the breast reductions to the rhinoplasties and now to these cases on About Face, which are just mind-blowing. So y'all need to go check out About Face on TLC. Go see our Dr. Millicent Rovelo be the superstar surgeon that she is every Wednesday. And we will be back for more, and we'll be giving you all more updates and more behind the scenes as it goes along. And we want to fan the flames for season 2. Come on, give us more. We want more. So thank you again, Dr. Rovelo. Your work is amazing. And this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.